So I see you're having some limited range of motion in your wrist flexion. So today we're going to perform a technique that kind of helps alleviate the kind of the pain or discomfort that you're having. Just remember, this isn't a permanent fix. It's basically just to kind of loosen all the ligaments and connect all the structures in your wrist, help you get that range of motion. And then we're going to just continue with the exercise program. You shouldn't feel any pain with it, but if you do, definitely let me know.
Okay.
All right, I'm going to perform a dorsal glide of the radiocarpal joint. So I'm just going to have you go right here. And I'm going to stabilize with the stability hand right here at the radius and ulnar. And then I'm going to put my mobilizing arm right on the carpal joints. And from here, I'm just going to provide a dorsal glide. You're going to feel it kind of come loose a little bit. And if the patient is high irritability, I'm going to perform a low grade where I'm not going to the end range. And if they're low irritability and more stiff, then I'm going to perform it at the end range with the high grade. So we're going to start with the low. Just kind of go there, back and forth. And then we would test it afterwards, and then retest the end. And then if we're doing the high grade, we're going to move it right to the end range and oscillate it back and forth a little bit. And we're going to perform that for a minute or two, and then we would retest. Okay. If we're doing a more aggressive approach, we are going to put the wrist in the patient's range of motion that they actually had. We're going to stabilize the radius and ulnar. Mobilizing arm is going to be in the carpals. And from there, we're going to go at a perpendicular. We're just going to oscillate back and forth there. Because the ligaments are more taut, we should have a little bit less range of motion or a little bit less play than we did when it was at the neutral. But like I said, this is a more aggressive approach. And because we're doing the dorsal glide, we're going to be working on the flexion of the wrist.